have seen a drastic increase in behavioral health patients in the emergency room since the Parkland shooting. It was in our backyard. It hit the community hard, and the kids, it got their wheels spinning.
Children face enormous pressures these days. Social media is a pressure that didn't exist when I was in training, and the pressure to be on all the time to their peers and families, where mood and anxiety is determined by how many likes you get.
There is the pressure of school and life in general to please your parents, and believe it or not, our numbers are very cyclical around the state testing. Final exams, midterm exams, you see increased anxiety levels and patients showing up to our emergency room for anxiety and depression during these times.
The goal, of course, is to avoid emergencies.
She had like a bunch of girls over, she just wanted to do something.
One of my daughters has been coming to Dr. Ruby for about a year, and the other daughter started maybe 6 or 8 months ago. Principally because the first daughter was really seeing significant benefits from having a chance to talk with Dr. Ruby and work through some of her issues about some anxiety related to school.
Just to prepare for like the AP exams.
You don't want a fever of 102 to become 104. So seeking out treatment early, that's consistent, that's regular, is of the utmost importance.
I've had so much support here. This is like the place where I come to get grounded, get collected, and be able to get better.
I think he's helped them in terms of focusing more and not being quite as anxious about things, and it's been very positive.
Kids and parents, and I'm guilty as well, you've got to put the phone down. There's no amount of games or reading or news or celebrity entertainment news that's going to replace that time and that contact with your kid.
Be aware. Speak to your children. Pay attention to them. Also notice some of the little things. Changes in school performance, changes in eating habits, changes in sleeping habits, change in levels of energy, feelings of hopelessness, helplessness, worthlessness. Pay attention to self-esteem. Don't just necessarily say, oh, it's a stage. Stages don't last for 2 to 3 or 4 weeks. If there's a family history of anxiety, plus these changes, that makes it more worthy of an assessment. Nowadays, screening for depression is part of an annual physical. So it's always good to start with somebody who knows your child the best. More often than not, that's a pediatrician. To be able to say, I just think that things are different.
Open up the phone book or Google on the internet a licensed case social worker that does therapy in your community, and just get that entry point. Reach out and make that connection. We've got to get this done for our kids and make sure that they have a good transition into early adulthood, and maybe they can be part of the solution tomorrow. So that's really where it needs to head.